and welcome to all our viewers from around the world. I'm Kristen Schwarz, licensed midwife and MC here at Gold. And here at Gold, we are preparing for a brand new lecture pack titled Preventing and Healing Perinatal Trauma. And I'm here with one of our speakers, Dr. Justine Leach. Welcome, Dr. Leach.
Thank you so much. I'm so excited to be here.
Oh, it is wonderful to have you here today. Perinatal trauma is such a big topic. It's so important. We always try to include the topic in our conferences, and but it's very complex. So we have decided here to create a whole new lecture pack, all dealing with perinatal trauma. And we're so glad that you're part of this. So tell us a little bit about yourself, your background, and where in the world you are.
Sure, thank you so much. So I am coming to you from Boston, Massachusetts. You might notice from my accent that I have more of a British accent. That's where I grew up, but I had both of my children here in Boston. My background is actually as an academic. I was doing my PhD on representations of sexual consent in narratives of rape when I was pregnant and having my two children. I myself am a survivor, and what I experienced through both of those births really taught me and showed me that there is a gap in training for perinatal professionals, healthcare workers in supporting survivors giving birth. And so I actually left my career as an academic to retrain as a childbirth educator so that I could provide that support both to parents so that I can help them to prepare for birth in a trauma-informed way, and also to be there as an educator, an advocate, somebody who's helping to make change in the world by working with professionals and helping them to understand the needs of survivors during this time.
Well, thank you so much for sharing your personal journey there, and thank you for all the wonderful work you're doing out there to the in the community. In recent years, we have become more and more as healthcare providers. We're learning more and more about trauma-informed care. And I have to tell you, for me as a midwife, sometimes it is not easy to recognize a survivor, right? I mean, we're trying to have good conversations and when we're meeting our clients. But of course, not everybody will be forthcoming or wants to be forthcoming with that kind of information. So what can we as healthcare providers or anybody working with families, expecting families prenatally or postpartum too, of course, what can we do right from the start when we meet somebody, a new client, to give them the feeling that yes, we are here, we're listening, we are there for them, without kind of poking around in there. Does it make sense what I'm trying to ask here?
Yes, absolutely. It's a wonderful question, and thank you so much for asking it. We know that maybe only something like 3% of people who have a trauma history will actually disclose in an initial meeting with their midwife or their OB. So it's really important to be aware that many people have trauma and to practice from that place of awareness, whether or not someone has disclosed or chooses to disclose with you at some point on their journey with you. So that would be the number one thing I would say is to really just to treat everyone as though they potentially have some trauma, and to think to yourself, well, maybe how I would treat a survivor is how I should actually be engaging and interacting with every single one of my clients or patients throughout this time.
Absolutely. That's a very, very good point because yes, trauma-informed care treat everybody as though they could be a survivor. And we don't know what other traumas, people have experienced in their lifetime. It doesn't necessarily need to be rape. It could be, other forms of abuse or traumatic experiences, be it a traumatic previous birth, for example, as well, right? So that is a very, very valid and good point to treat everyone with the same dignity, respect, and care. And
Yeah. Yeah,
uh,
absolutely. I mean, I think that when also for survivors, the term survivor, not everyone identifies as a survivor, not everyone will identify as having experienced trauma, but that
Mhm.
doesn't necessarily mean that in certain situations they may not, they are protected from having something come up for them from their past. And so
Mhm.
they may not have identified and said, yes, I'm a survivor, or yes, I have trauma, but they may still have a physiological response to something that could be a
Mhm.
trauma response. And so it's just really important to be aware
Yeah.
throughout our care.
Yeah, and I've noticed that too in my practice too, that, and I think many of us, or even if it's a childbirth educator or doula or anybody in that position, has probably experienced that you have a client and you're not aware that, they had a traumatic experience and they're not disclosing anything. You feel like you have a good relationship, the care is going well. And then during birth, all that trauma breaks open this because
Mhm.
something is possibly triggered during birth, right? So that
Mhm.
can also happen. So what do you suggest in cases like that? I know it's a big question. We could probably talk for hours, but like what? Because I think that's such an important topic. What
Mhm.
can you tell us there?
I think it's very important to be attuned to what is going on in the body of the person that you're supporting. And if you're
Mm,
noticing a shift, it might feel like disconnection, whereas before that vaginal exam, you were in
right.
connection with that patient or that client. You were together with them. And now after this event, after this thing that happened, you just can't feel it anymore. It's like the rope that you were holding for them that was connecting you to them has been severed.
Yeah.
And so one of the important things that you can do is actually notice, like first of all, notice within yourself, what are you experiencing, and
Hmm.
use that knowledge, because that is really important knowledge. So
Hmm.
use that knowledge, settle your own body first, because
Hmm.
when we ourselves are settled, then that helps to support and co-regulate the person that we are
Mm,
helping. Just like when the baby comes to the chest after the baby is born,
right.
and the parent's body helps to co-regulate that baby, their sense of the smell, the heartbeat, the breath, the warmth, all of that brings the baby down, right, into to calmness.
Right.
Right? Just like that, we as people who are in the same space as this birth giver have that power as well. But we have
Mm,
to come with that regulated body first. And
mm,
then I would say that the next step would be to just do a check-in and say what you have noticed. I've noticed that you seem to have gone somewhere else right now. I'm feeling that there's this connection, like it's seeming hard right now, and it feels to me like maybe you've kind of closed off. I can see in your body that there's been a shift.
yeah.
You don't
Yeah.
look so comfortable anymore. I'm just wondering, am I right about that?
Hmm.
Right? And then this is an invitation for reconnection. And that
Right.
invitation may not necessarily be taken up, right? Somebody,
Right.
if they have experienced a lot of trauma, may not be able to come back.
Mhm. Mhm.
But even that moment of being noticed is
Mhm.
so powerful. One of the experiences of trauma is of isolation, of
Ah,
nobody understands me, nobody sees me. And
right.
so by offering that moment of I see you, I see that something's happened here, even if they can't come back, it is protective and it is helpful.
Mhm. Oh, thank you. That is such great advice. This is such a wonderful. Thank you for talking to me here today. This is like such valuable information that you're sharing here with us. And you're so right. This check-in, number one, that we are kind of centering ourselves and kind of coming in. When we see something is shifting, and then these questions. I see that something has shifted for you. What um, that that is wonderful, the invitation to share, because sometimes it might not be anything that we did,
Mhm.
as providers. That we might be very aware of trying to be really provide good trauma informed care, but then maybe the woman in labor goes into transition, and this is the next level, and that could be very out of control and scary to that,
Mhm.
her, and that could be triggering something. So So having this kind of centering ourselves and then being with her and
Mhm.
checking in with her might
Mhm.
be a wonderful tool to utilize
Yeah.
there.
Yeah.
Thank you.
And coming to them with from a place of humility. We don't know
Yeah,
that something is necessarily a problem. So asking, like, I'm seeing something. Is there something going on that you want to share with me? This is
mm,
what I noticed in your body, right? I'm not
mm,
making assumptions about what you might be experiencing, but
right.
I've noticed something.
Ah, wonderful. Thank you. Now let's talk briefly about your presentation here. The title of the presentation is Beyond the Birth Plan, Trauma-Informed Childbirth Preparations for Survivors. Just give us a little bit of what we can look forward to hearing from you.
So I love birth plans, and I think they're very important. And I also think that they can be misunderstood as to
Mm,
what their role is and how powerful they can be. And so what I'm wanting to do is I'm actually wanting to reframe what a birth plan is. But not just that, right? It's not just about birth plans, because I know that not everybody watching this presentation is going to be directly helping someone to develop a birth plan, but also reframe for you what it is that trauma-informed birth preparation actually looks like. What are the right questions that we should be asking? What is the understanding that we need to
mhm,
have when we are working with a survivor, somebody who has disclosed to us potentially that they have a trauma history? What do we need to put in place ourselves to be able to support this person? And how are we thinking about their birth preparation? What are they preparing for?
mm,
What are
mm.
our goals for them in birth? Right. And so I'm hoping to
Yeah.
reframe all of this for you.
Oh, wonderful. Oh, Dr. Justine Leach, I'm so happy that you came here with us, to us, speaking with me here today, and I can't wait for your presentation.
Thank you so much. I'm excited.
And for our viewers now, the presentation will be available on October 5th and is part of our Preventing and Healing Perinatal Trauma lecture pack here at Gold. If you have any questions, you can post them below. And if you'd like to find out more about this lecture pack, you can go to Gold. Birthandbeyond.com and also to goldlearning.com. Thank you everyone for watching and have a good day. Bye bye everyone.